Again, in the Legislative Building in Regina, we have Premier Scott Moe. Joining us by video conferencing is Dr. Saqib Shahab and SHA CEO Scott Livingstone. Both the Premier and Dr. Shahab will have an opening statement. Dr. Shahab will also have a brief presentation to give, followed by questions.
Well, good afternoon, everyone, and thank you for joining us here today. The case numbers in Saskatchewan continue to trend in two very different directions. In most of our province, the number of COVID cases is stable or is actually declining. However, here in Regina, we are seeing case numbers continue to rise, and that is largely due to the high concentration of variant cases in Regina. As a result, today we are announcing a number of public health orders that will apply only to Regina as well as the surrounding communities in the vicinity of Regina. Effective immediately, household gatherings go back to where they were a few weeks ago, and so that's no gatherings with people outside of your own household, with some limited exceptions for people that may be living alone, co-parenting arrangements, of course, service providers and caregivers. We are strongly recommending that if you are able to work from home, you should work from home. Banquet halls, community halls, art galleries, museums, libraries, cinemas, arcades, bowling alleys, event venues, live theaters, and the science centers must close effective midnight this Saturday, March the 27th. Also effective this Saturday at midnight, bars and restaurants must close for in-person dining. Takeout and delivery can still occur. A strong travel advisory is being issued for Regina, and we are asking everyone to limit your travel both in and out of Regina. So for now, if you live outside of Regina, we're asking you to not come into the city unless it's necessary. If you live in Regina, we're asking you don't leave Regina unless it's absolutely necessary. We recognize that some people will have to travel in and out of the city for work, for medical appointments. We're asking you not to enter or leave the city just simply to visit or to shop. We're asking you to limit your travel in and out of Regina as much as you can. The Saskatchewan Small Business Emergency Payment will be extended to those businesses that are impacted by today's announcement. Federal supports available also, such as the employment insurance and the Canada Recovery Benefit, are available to workers whose jobs are impacted by these measures we're putting forward here today. Again, the measures that we are announcing today apply to Regina as well as the nearby communities of Belle Plaine, Pence, Grand Coulee, Lumsden Beach, Regina Beach, Craven, Lumsden, Edenwold, Pilot Butte, White City, Belgoni, Crono, Darwin, Grey, and Royston. In the rest of the province, the current public health orders remain in place. All of these public health orders are now in place until April the 5th, including those we've announced here today, and they'll be reviewed at that point in time, but it's very likely that they may have to be extended at that point in time. Today we are at a very challenging moment in this pandemic. Each day we are vaccinating literally thousands of Saskatchewan residents, and this is bringing us closer to the day when things will be able to return to normal. At the very same time, the rise of the variant cases means that we have to continue to be extremely cautious, in particular here in Regina, but I would say extremely cautious in communities across the province. That is until we are able to get a whole lot more people vaccinated. Our vaccination rollout is going extremely well. It's leading the nation, and that is thanks to the great work of our frontline healthcare workers in over 100 clinics that have been operating throughout the province. And thanks for sure to the thousands of Saskatchewan residents who are making appointments or lining up at the drive-through recently here in Regina to get vaccinated when it is their turn. For that, we are very grateful. Nearly 150,000 shots have now been administered in the province. In fact, as we're speaking, we probably have hit 150,000 shots. And we're only limited in this province by the supply of the vaccines that we are receiving. While vaccine deliveries from the federal government have increased significantly in the past few weeks, our system can definitely handle more, and we could be going even faster if we were able to access those vaccines. Today, Saskatchewan, as I said, is leading the nation in both per capita vaccinations, and as well, we're leading the nation in the percentage of the vaccines that are being delivered. As we receive them, we make them available to Saskatchewan people virtually immediately. As of yesterday, our healthcare workers had administered 99% of all of the vaccines that have been delivered to the province. That's an incredible number. The Regina drive-through clinic has been a huge success, vaccinating over 2,000 people each and every day it was open. And unfortunately, that means that we have now completely used up that first supply of AstraZeneca doses that we had, and the drive-through has had to close temporarily until we are able to receive some additional vaccines. Now, the federal government has said that the batch of 1.5 million AstraZeneca doses that Canada would be receiving from the United States should arrive before the end of this month, and we are ready for that arrival. Saskatchewan's share of that 1.5 million doses would be about 45,000 doses. And because of the success of the Regina drive-through clinic, those doses will be used to, again, reopen the Regina drive-through clinic. And we'll have the opportunity then to open additional clinics in the communities of Saskatoon, in Moose Jaw, and in Yorkton. And we look forward to being able to open those as soon as we receive these vaccines. Our appointment system has also been working extremely well. And we will continue using the Pfizer and Moderna doses to vaccinate the thousands of Saskatchewan residents who have booked their appointments online or booked them by telephone. And we're expecting our next batch of 36,000 Pfizer vaccines should be arriving today. That will be our largest Pfizer shipment to date, and that shipment will then be sent to Regina, Saskatoon, as well as into the community of Yorkton. Our next shipment of Moderna, which is sent to clinics in many of our smaller cities, towns, and rural communities throughout the province, is expected to arrive later this week. We are seeing a very high uptake in the age groups that are eligible to be vaccinated so far, and that is a very positive indicator. So again, I would say thanks to everyone in Saskatchewan who is doing your part by making your appointment, and when it's your turn, getting vaccinated. And to anyone who still may be reluctant, I would say this: vaccines do work. They are the best way for us to not only protect ourselves, but protect those around us. And they are the way that we are going to be able to lift the public health orders and have things get back to normal at some point here in Saskatchewan. We look at countries that are a little further ahead than Canada in getting their residents vaccinated, and we are seeing significant declines in not only the number of cases, but the number of serious outcomes in those cases. Israel, for example, has seen an 85% drop in new cases and fatalities since their peak just as recent as back in January. And I think that's what we can expect to see here in Saskatchewan as we endeavor to get more and more people access to this vaccine and as Saskatchewan people choose to be vaccinated. By the way, we are going to get to the end of this pandemic. We just aren't quite there yet, and I think that's most evident with the announcements of the additional measures that we're putting in place in Regina and the surrounding area today. But once again, I would ask everyone in Saskatchewan to continue doing what we're doing. Continue following the public health orders. Continue following the guidelines that have been put forward by Dr. Shahab. And most importantly, when it's your turn, make your appointment, take your shot, get vaccinated. It's good for all of us. Thank you. Dr. Shahab.
Thank you, Premier. So good afternoon, everyone. So as always, I'd like to start by offering my condolences to the family and friends of the 8 residents who have passed away since March 19th. Just a reminder that as vaccinations are picking up, we still have to stay the course and protect ourselves and our loved ones till we get vaccinated. And vaccines start working 3 weeks after your first dose. As the Premier said, we've been monitoring the indicators for Regina and area for the past several weeks. And, we, despite all our best efforts of everyone in Regina, the numbers have continued to climb, necessitating the need for additional measures announced today. They will be in place for as short a period of time as it takes to hopefully turn things around and have Regina also trending downwards like the rest of Saskatchewan. And we all recognize that while the rest of the province is trending down, we need to stay the course and give ourselves, 4 to 6 weeks so that everyone, 50 and older is vaccinated. And then after that, everyone 18 and older steps forward when the time comes to get vaccinated. But the rest of the province obviously has the ability to make household bubbles, to have larger worship services. Other measures remain in place for the time being. And we need to stay the course throughout Saskatchewan, But unfortunately, in Regina, we are back to the restrictions that were in place 14 December. No household bubbles, unfortunately, beyond the specific exemptions. Worship services remain at 30. But unfortunately, some additional restrictions that are now necessary to really make our case numbers start going down. And really, I'll just maybe show a few slides to just demonstrate why, unfortunately, this is so important at this point. Um, so just 4 or 5 slides. This, of course, shows how the entire province is trending down. If we didn't have the issue in Regina, our case numbers would have been less than 100, 120 a day. So the rest of the province is coming down really well. We need to stay the course for the rest of the province while our vaccination numbers pick up. Regina, unfortunately, the numbers have been trending up. And primarily, it's because of variants of concern. They are 70% more transmissible. So even workplaces that were following protocols that worked for the last 14 months, they were failing, unfortunately, over the last 3 weeks. And so that's why some further restrictions had to be put in place. If you look at our numbers by geography, numbers we hadn't seen since November. Daily case rates overall actually had come to below 10, and for the most of the province they are below 10. The only concern, of course, is Regina, and then testing rates are up. Test positivity is down 5%, with the exception of Regina. Obviously, some smaller geographies with smaller number of people, they do see more fluctuations. But overall, it's a very positive picture throughout Saskatchewan. But we need to stay the course, not relax beyond what's currently in place. And Regina needs some additional measures to help us come down here as well. And this was provided by my colleague and medical health officer in Regina, that it just shows how daily cases per 100,000 have been trending up throughout the last 3 weeks, from 16 per 100,000 to almost 30. Active cases obviously going up, test positivity going up. The only positive thing is testing rates are also going up, and that is really good. But we need to remember that obviously the more testing there is, we will see an increase in numbers, and that's a good thing, because if you test positive, you isolate, your close contacts are identified and isolate, and that is one way of bringing numbers down. And finally, these slides have been shown before by me, at the physician's town hall. And this just shows the black dots are where our numbers are tracking in Saskatchewan. So this is really for the whole of Saskatchewan, but the upward trend is primarily because of the increase in cases in Regina. And this shows the ICU census. But if you look at hospitalizations and ICU admissions, everywhere in the province, they're trending down. In Regina, unfortunately, they're trending up. Thankfully, not impacting long-term care to the same extent, but unfortunately, because the variant is more transmissible, slightly more virulent, we are seeing increasingly, 40 younger people in their 40s, 50s, 60s in ICU, and this is something we really need to address. And with all the measures announced today coming into effect today, no household bubbles, and then on Saturday, further measures, we will see, for 2 or 3 weeks, the numbers in ICU and hospital going up, because there's a lag in 2 to 3 weeks. Our daily case numbers, we really hope to see them coming down within a week. But then once, but we do want to see them trending down by maybe 2 to 3 weeks. And really, we want to track somewhere between the yellow and green line. We are putting in very significant measures for as short as a time as we need to do, but this is essential to bend the curve down from what otherwise would be very concerning trend for Regina, and then it could start impacting other parts of Saskatchewan as well. So again, the measures we need to observe throughout Saskatchewan while our vaccination rates pick up remain the same, but we need to be especially diligent in Regina. And I think it just speaks to the fact that if we all followed these measures throughout Saskatchewan, and just those additional measures in Regina, I think this is what we need to do to kind of, uh, sorry, just need to. This is what we need to do to really make sure that our numbers start trending down. So I'll maybe just stop there and I don't know, hand back to you, Premier or Scott.
Thanks very much, Doctor. We'll now take questions, and we'll start with our first question from the phone line.
We have Stephanie Taylor with the Canadian Press.
Hi, thanks for taking my question. Mr. Premier, we're headed back into a lockdown, or however you may want to characterize it, slowdown, shutdown in Regina, which is something I know you and others wanted to avoid. So did your government underestimate the potency and the power of these variants to spread COVID-19?
I think Dr. Shahab can speak to the variants and the ability that they have to transmit at a much higher rate than even what COVID-19 has. But no, with respect to the measures, that the additional measures that are being brought forward here today, they're being brought forward over by Dr. Shahab as discussions went on, I think, in fairness, over the weekend into all throughout yesterday and even up until this morning, just on how we can most effectively, bring forward a suite of measures. And there's a significant suite of measures here that will be added to the already existing health measures that are in place across the province to ensure that we're able to decrease the rate of that transmission of what is predominantly the variant cases here in Regina. Again, this is to ultimately preserve the healthcare capacity that we have, not only here in Regina but obviously across the province, and we're most notably in Regina. But there's variants. I think also we should be aware and not kid ourselves. There's variants that are present in various communities across the province. The challenge we have in Regina is that the concentration of the variants in Regina seems to be very, very high. So we're asking all Saskatchewan residents to continue adhering to the public health measures, the recommendations that are in place, because the variants quite likely are in or around a community near you. And in particular in Regina, it's Dr. Shahab's feeling, and I agree, that we need to go a little bit further here to ensure that we're pulling those numbers down in the weeks ahead, until such time that we can get additional vaccines out to the folks in Regina. And as I said, if we're able to receive the Biden vaccines, the President Biden's vaccines that he's providing to Canada, we'll get our drive-through facility up and running again here in Regina, and we'll add Saskatoon, Moose Jaw, and Yorkton to that list of having drive-throughs as well. Dr. Shahab, anything to add on the variants themselves?
Thanks. So I think on the one hand, the rest of the province is showing that even though we are having sporadic variants pop up throughout the province, we need to stay the course and keep our numbers low while more and more people get vaccinated. But Regina, I think, is similar to several jurisdictions in Canada where really over the last few weeks, the variants which are more transmissible have taken over. That has happened in other places in Canada. We've seen how it's happened in Europe, necessitating more stricter measures, even though all of us in Saskatchewan, Canada, the UK, Europe have increased our immunization programs. So while immunization programs pick up speed, we still can't ignore public health measures that sometimes have to be tightened, as they have had to be in Regina, just to deal with what was in Regina a very concerning trend, like I showed in the slides. Even though thankfully long-term care facilities are not being impacted that much, the case numbers were trending up, impacting all age groups, but especially the working age adults. And again, adults working hard throughout the pandemic with good protocols were getting exposed now more than before. And it also speaks to the fact that all of us need to revisit our protocols if we are working outside the home. All of us who visit for essential shopping, need to make sure that we do everything to protect ourselves and others. Stay home if you're sick, get tested. When you're out and about, use your best mask, your best 3-layer mask, or your best disposal mask. Wear it tightly around the face. Be out and about in an indoor place for as short a period of time as possible. With spring, enjoy the great outdoors as much as possible with your own household. But for the most part, minimize, as much as possible being indoors with people outside your household. And even in work settings, it is really during break times, during carpooling, other social connections that transmission is happening. But a reminder for all of us to take that extra care throughout Saskatchewan, but especially in Regina. I think it's really important to bring those case numbers down. Thank you.
Follow-up, Steph?
Yes, Mr. Premier, have you read the report prepared and released by the Civilian Review and Complaints Commission for the RCMP into the officer's investigation to the death of Colton Boushie? And if you have, what do you think about how RCMP are said to have treated Colton's mother, Debbie Baptiste?
So I have not read the entire report. However, I will be having a look at it as soon as I am able. So I've not read the report to date. I've seen some of the coverage on what is the content of the report, and I think from Saskatchewan's perspective, I would say, this really does, enlighten and I think give some substance to the conversation that we've been having with respect to, moving towards some civilian oversight or some public oversight of our policing services, whether they be RCMP or municipal police services as well. So. That is a discussion that has been occurring for some time in this province, and I think it's a discussion that you're going to see the government in the days ahead start to take some concrete steps towards.
We'll take our next question from the room. Lynn?
Yeah, Mr. Premier, doctors and NDP have been calling for more measures in Regina for a number of weeks now as we grapple with variants. And you've said that you're mostly putting this stock on people doing their part to follow public health measures as it were, because they were working. What changed that now you're bringing in more measures?
Public health measures are working across the province, save for Regina. And when you look at the numbers, and we looked at them earlier, the public health measures are proving to be quite effective, and the variants are present in other communities across the province. And so the public health measures are, I would say, proving to be very effective. In the case of Regina, what has changed or what is different than it was a short while ago is the concentration of the variants in Regina. They seem, the vast majority of the cases that are occurring in Regina and the more effective transmission of the variant in Regina is proving to, well, it's leading the nation, unfortunately. We have a higher concentration of variants in Regina than anywhere else I'm aware of in Canada. And so that is why I presume, and I won't speak for Dr. Shahab, he may have comment on this, I presume that is why Dr. Shahab has come forward over the course of the last number of days with some of the additions to the health measures for Regina and the surrounding area. That is why we reallocated about 2 weeks ago the 15,000 AstraZeneca doses that we received right directly into the community of Regina, and I believe we ended at about, Scott, you might correct me, 57 and over, folks 57 years old and older were able to have access to a vaccine here in Regina, and we're going to, if we receive these additional doses, allocate a significant number of those doses into the community of Regina as well. And that is to get ahead in the race of the variants and the vaccines in this community because of the concentration of the UK variant predominantly the UK variant in Regina. Do you have anything to add to that, Dr. Shahab or Scott?
Yeah, thanks, Premier. So from my side, I think all of us who live in Regina, when we're out and about, we do realize that people are doing their best. Restaurants and bars were doing their best, retail services, everyone was doing their best. But unfortunately, with the variant that's 70% more transmissible, there wasn't enough to bend the curve. And that's why we had to move to these additional measures. But we still need to try as hard as we can to do everything we've been doing for that little while longer, the next few weeks, to make sure that we minimize any transmission opportunities for B117 and join the rest of the province in low case numbers. And we're confident that, if we continue staying the course with these additional measures for as short a period of time as possible, we will be successful. And secondly, like the Premier said, it is important to get vaccinated when your time comes. I was privileged to, get vaccinated on Saturday with the AstraZeneca vaccine. As soon as my turn came up, I, joined my fellow Reginian citizens in line at the drive-through, and it was very professional, very smooth. Many of my colleagues in other parts of the country and actually internationally were very interested in how diverse the vaccination program in Saskatchewan is, both the appointments, the drive-through, the online bookings. It seems to be going very smoothly and is visible not just to all of us in Saskatchewan, ourselves, our friends and family who've been vaccinated, but it's also definitely leading the way nationally as well. So I think the message is that we now have 3 vaccines that are available for use in Saskatchewan. We may have more vaccines. The number of vaccines coming is increasing, but as soon as we become eligible, it's really important to go and get that vaccine, and then that protects you, that protects others around you, and it keeps the line moving. Thank you.
Scott, anything on the drive-through clinic? And it's closed here, I understand, recently. But was I right? We were down to 57 and older.
You were, yeah, you are right, Premier. And as you've already heard from Dr. Shahab, the response to that clinic was overwhelming, and we're very proud of the team on the ground who was able to deliver those vaccines so quickly, and looking forward to getting another allocation to be able to open up more drive-throughs, as well as to accommodate the 95,000 plus appointments that have been booked already through our booking system. So excited about being able to roll down into younger age groups, not just with the drive-throughs, but with the booking system as we move forward.
Follow-up question, Lynn?
Yeah. In Dr. Shahab's presentation, he said that protocols have been failing in Regina for pretty much the last 3 weeks here. So can you really say that previous restrictions were working to bend the curve and just people following if now we're having to bring in all these things and we've seen such a crazy, high, rapid increase over the last few weeks?
Absolutely. When you look across the province, I think it's evident that the protocols that are in place have been working quite effectively, and there are varying cases, a number of them across the province, and our protocols do seem to be standing up. And we are in this race between access to the vaccines and the spread of the variants, and the variants are more contagious, so they ultimately will continue to spread, across Saskatchewan, and that's why we are trying to limit our travel in and out of Regina, is to delay that spread to whatever degree we can until we have access to those vaccines, in particular access to those vaccines for those that are at highest risk of severe outcomes when it comes to COVID-19. The concentration of the variants in Regina is quite high, and that is why we are coming forward with a number of tools that we have at our disposal. The number of those are some additional health measures that we brought forward here today, including travel, including going to curbside in restaurants, including closing a number of facilities that would host 30 or so people. But we're also trying to continue with worship services, for example, understanding that people do need to have the opportunity to attend their worship service if they should so choose. The other tool that we have used, and I mentioned this before and we talked about, is the access to the vaccines that we have. Saskatchewan is leading the nation, and we have 99% of the vaccines that we've received have been provided to Saskatchewan people. We reallocated those AstraZeneca vaccines into the community of Regina because of the rise in the concentration of the variants here in this community. So when you combine the fact that we now have people 57 and older in the community of Regina, and I know of no other city in the nation that is that low in their age group in an entire city, have had the opportunity to have access to those vaccines that will become a real line of defense over the course of the next number of weeks. And as I said, we're just hopeful that we will get the additional Biden doses of vaccines so that we will be able to reopen not only this drive-through clinic, but move forward with drive-through clinics as well in Saskatoon and Moose Jaw and Yorkton, and really reduce or enhance the opportunity for access to vaccines in those communities as well. It's highly possible that when we look ahead to you know, the first week or maybe April the 10th, that here in the province we'll be in a situation where in Regina and the far north, we have provided access to everyone over the age of 50 with the vaccine. In the communities of Saskatoon, Moose Jaw and Yorkton, everyone over the age of 60. And in every other community through our appointment system, we'll likely be down into that 65 range by that point in time. So we'll be in a very, very different position here, even just in a number of weeks with the vaccines that we're anticipating that we'll have access to. And that's why I think Dr. Shahab has talked about these public health orders that we're putting in place today. They'll be revisited on April the 5th. But they're here to be in place for as short a period as possible until we can start to just nudge the numbers down and ultimately start to forecast that the hospitalizations would start to drop here in Regina. But you know, the most important things again here today is for all of us to just continue what we're doing. In particular, we need to be very diligent in Regina with the public health measures, but I would say we need to be very diligent across the province as well, as the variants aren't only in Regina, they are in a number of communities across the province. The challenge we have is the concentration of variants in Regina is much, much higher. It will be higher eventually in other areas of the province. We want to delay that as long as possible so that we can get the vaccines out to everyone. Doctor or Scott, anything to add on that?
Yeah, I'll just maybe comment especially on the protocol. So we've seen that all the other places in Saskatchewan, they've kept the numbers low. The reopened Saskatchewan guidelines, the orders in place are effective. But we still need to follow all those guidelines when we're out and about throughout the province, like the Premier said. But in Regina, because the weight is 70% more transmissible, those same measures were not proving sufficient. So that's why we just had to put some additional measures in place, accelerate the vaccination program, and both of these hopefully will work for Regina in the short term. The next 2 to 4 weeks, hopefully, it will turn things around. But we all need to do our part. I think if all of us in Regina behave more like we were behaving in March 2020, this can turn around very quickly. And for the rest of the province, you know, thankfully for the last several weeks, we haven't seen any super spreader events. So as we are able to, in the rest of the province, make household bubbles of up to 3 households, you know, expansion in worship services in the rest of the province, we still need to diligently follow all the protocols when we go to a restaurant, when we go to a place of worship, when we carefully make a household bubble, shield those who are days away from getting vaccinated. You know, it takes up to 3 weeks from your first dose to have some protection, but I think be considerate for those who may have underlying risk factors, who are older, let them get vaccinated, stay in touch, meet and greet outdoors safely from a 2 meter or greater distance. And really, you know, we need the time. It's just a few weeks now when, you know, like the Premier said, everyone 50 plus is vaccinated. And then of course, we want everyone 18 and older ultimately over the next 2 to 3 months to come forward and get their first dose, and then over the summer complete the second dose. I think we really need as high an uptake of the vaccine over the spring and summer as we can achieve. Thank you.
What does it mean for sports in the area? There are some youth hockey teams that are still practicing, and the WHL hub is in Regina.
Dr. Shahab, do you want to speak to?
So, you know, so far the Western Hockey League hub is working successfully. They're working closely with public health officials in the city, with the city of Regina, with the University of Regina. It's a very professional approach that they've deployed, and it's working well. But again, you know, that hub exists in a city that unfortunately now is seeing high rates. So they need to, again, everyone needs to be very diligent with the protocols within the WHL hub, but so far it's working well. Thank you.
You have a follow-up, Lisa?
Yes, so just to be clear, that means that there's no change to the WHL hub. That's not going to end. And what does that mean for youth hockey teams that might be practicing right now?
I think the other sports initiatives really will remain at the current restrictions. We'll have to look closely at, you know, what's possible over time. But I think this is not the time, especially in Regina, to you know, introduce any further relaxations, unfortunately. We already saw that. And again, I have to stress that, even though we were all trying our best, just that slight lapse, unintentional, introduces COVID into families, and then we were seeing introduction into schools in greater and greater numbers, and that's why schools in Regina are going online over the next couple of weeks. High schools this week and elementary schools next week. Again, schools otherwise are working well. All the layers are working, and they just reflect community transmission. That's the same issue is not happening in other schools in the rest of the province who are doing extremely well. But it just, the 70% higher transmission was just impacting all aspects of our lives, whether we are at a workplace. We just need to be that more diligent with our, mask use, PPE, especially in common areas. Be extremely diligent at break times, maintaining that 2-meter distance with colleagues. Try not to carpool as much as we can. Wear a mask if you have to be in a vehicle with someone else, and wear the mask as tightly as you can, your best mask as tightly around your face so that you breathe in and out from the front of the mask, not air escaping from the sides. And I think, and of course, at the slightest sign of symptoms, get tested, make sure your close household contacts are able to isolate for the 14 days as well as required. And if additional isolation is required, that may still be required in Regina because of the variants of concern. But I think all those measures that have served us well are doubly important in Regina because the variant is almost twice as transmissible. Thank you.
Take our next question from the room.
Report.
Mark?
Dr. Shahab, have there been any disagreements between you and elected officials about how to respond to the rapidly increasing case numbers in Regina?
Well, I think from my side, and I think it's obvious to everyone, this is not just a public health response. This is an all-of-government response, and these are difficult decisions for everyone. They're difficult for public health. They're difficult for me. They're difficult for the government and elected officials. These are not easy decisions. These impact our lives. They impact, the business of our friends and neighbors. These are not easy decisions, but again, I think they have to be evidence informed, which they are. They have to be proportionate to the issue, which I think we are trying to be in Regina and also in the rest of Saskatchewan. And they need to be nimble. They need to be progressive when they're required to be, and then be able to relax. And I think it's a fine balance. And I think we, from my side, we do our best to bring the best evidence and the best protocols for discussion. And ultimately, I think it's an ongoing, and it's not just the public health measures. It's also at the same time we're launching the most ambitious vaccination program in our history, and it again is going seamlessly. And I think all these things are complex things. We've got the Saskatchewan Health Authority, we've got many municipal partners, Indigenous partners involved. So it's a complex undertaking, both ongoing public health measures, which in the case of Regina need to be tightened as required. None of these are easy decisions, but on a positive note, we have a very ambitious vaccination program that's moving ahead in a very smooth and systematic way. So again, I think there's long discussions that happen at every level, at a municipal level, at a provincial level, certainly with my counterparts, and I'm sure at other tables nationally and even internationally, I think. So, but again, I think it is important for us to do the best we can, have the least impact on our lives, but also at the same time minimize the most serious outcomes of hospitalization and death. And I think that's the balance we're trying to strike in an ongoing way.
I would just comment a little bit on the all-of-government response. Dr. Shahab provides the government with what I would say has been very, very appreciated health advice with respect to the measures that do go out under his signature. But there is an all-of-government response, even in today's announcements. There's the extension of the small business emergency payment, for example, which will be money flowing out to those businesses that are impacted by the unfortunate decisions that we need to make here today. You're going to see signs, mobile highway signs, start to pop up at the entries in and out of Regina, reminding people that We just don't encourage, nor do we want people traveling in and out unnecessarily. And so you're going to see the Ministry of Highways starting to place signage at the entries and exits of the city of Regina. You think back throughout this pandemic, the Safe Restart Agreement that we had worked through with our school system to fund, and the high level of substitute teachers that they needed, but also much of the safety equipment that has went into our schools, which I think for the most part in this province and across Canada, but in this province has proven to be effective. And that was a federal provincial effort totaling about $155 million. And so, that speaks to the all of government response that is required when public health measures are put in place. And but I would just come back to the public health measures and once again thank Dr. Shahab for the effort and the advice that he continues to come forward with, even at these late stages of us managing our way through this pandemic.
Follow up, Mark?
Yes, Mr. Premier, the spring sitting is supposed to start in a couple of weeks. How will the advisory against travel to and from Regina affect that?
Well, sure. So as you can see, I'm in Regina, and so I'll be here for the duration. I have one medical appointment that I may have to leave for. I'm trying to make arrangements with respect to that, but I'll be in Regina for the foreseeable future, not in my home community. As we look forward to the session and the last number of days, Dr. Shahab and relevant ministers have been focused in on where we are going to arrive at so that we can change the trajectory in Regina and the surrounding communities. We very quickly will be engaging with Dr. Shahab on what our spring session may look like. It could range from online, if that's possible, and we're not certain that even is possible at this point in time, to something similar to what we had last fall, where we had a reduced number of people in the House, but we did have an in-person sitting, and that was approved by Dr. Shahab at the time. As far as travel would go, I would say that any and all MLAs, irrespective of their party, if they are traveling to Regina, they should stay in Regina upon arriving here. Or stay in their community until such time they would be required to come to Regina. If we do move forward with an in-person setting, we obviously then would have to move into Regina and not be traveling back and forth, should this travel advisory still be on at that point in time, and it most likely will be at least at the beginning or the outset of session. In saying all of that, we do need to introduce a budget so that government and pass the budget so that government can continue to function and continue to support Saskatchewan people throughout this pandemic. So there will, in some way, shape, or form, be a budget that will be introduced and passed in Saskatchewan as soon as we're able.
We'll take our next question from the phone line.
We have Roberta Bell with Global.
Hi, my question is regarding the previous advice and the calls that had come out of Regina last week. I heard from various sources in the medical community that some public health officials in Regina were calling for these types of restrictions much sooner. The mayor had said she was willing to do anything Thursday morning prior to the press conference on Thursday. And then that slide that was in our presentation from Dr. Shahab today was also in the SHA presentation at the physician town hall. So I'm just wondering why it took so long to hear the calls coming out of Regina.
Well, we, as we said, this is part of a number of approaches that we have taken, and Dr. Shahab or Scott, if you'd like to comment on this, feel free. But this is part of a number of approaches that we have taken with respect to the increasing concentration of variants in Regina. And as I said, we have variants in numerous communities across the province, but they are at a very high level in the community of Regina, which is why we have provided additional vaccines into the city. And as we said, the drive-through clinic has been very popular and has been very effective in getting our AstraZeneca vaccines into people's arms, and in particular, in this case, getting them into people's arms in a community that has a high concentration of variants. In fact, I'm not certain on this, but if we aren't the first, we would be among the very first to exhaust our AstraZeneca vaccine supply in Canada, and that's a credit to all of the folks that work so very hard to ensure that the vaccine the drive-through vaccination clinic was the success that it proved to be. And it's our hope to get it up and running as soon as we're able to receive some more vaccines. This is another step in that approach in bringing forward a number of additional health measures, hopefully for what will be a very short period of time, just to start to nudge, as Dr. Shahab said, those numbers down and start. The hope is to ultimately start to decrease the hospitalizations, in particular the hospitalizations that we have here in Regina. But it will not be, and it is not the intent at this point in time, that these measures will be in place for a long period of time. They'll be in place until we can change the trajectory of the numbers, and then ultimately have access to much more vaccine and make that available to the people in this city as well as a number of other cities in the province. But Dr. Shahab, anything to add to that?
Yeah, I think, what I like to say is that, as I showed the numbers, I'm in daily communication with all my colleagues throughout the province and, of course, in Regina. And there was no one single setting where transmission was happening. Initially, it was mostly workplaces, but, a bit here, a bit there. And that's why the additional restrictions are really an additional kind of layer on what we were all doing. And they're just essential because our numbers were trending up, going up from 10 per 100,000 to 16 and then 20 per 100,000 and now almost 30. So the last week it became obvious that what we were doing was not enough. And obviously ICU admissions and hospital admissions were also trending up. On a positive note, outdoors is safe as long as you maintain that 2-meter distance from people not in your household. The weather's been great for the most part. There's lots of opportunities to enjoy the outdoors, which all of us should. So there's many positives happening at the same time. And certainly whenever something happens, it's concerning, but we know how to respond to it, how to manage it. Even if it's a vein of concern, we know how to deal with it, and that's what we're doing. And hopefully, this will be a last big challenge in Regina and hopefully in the rest of the province as our vaccination numbers come up. And again, the vaccine supply is strong, and it's really important that as the vaccine becomes available by age, we really step up and get vaccinated, because that is going to be, at the same time, very important as well. Thank you.
Follow-up, Roberta?
Given that the trajectory showed that we would be on this course of, exponential growth, and in previous instances in the pandemic, we've had modeling that has showed that, why do we bring in the restrictions after we start hitting these drastic numbers in ICU admissions, as opposed to proactively before when the modeling is introduced?
Well, I think when you look at all of the modeling that has been introduced over the course of this pandemic in Saskatchewan or across Canada, we have repeatedly taken and implemented measures to ensure that the worst case scenarios in each of those modeling cases is never achieved. And we feel that is going to be the situation here today with the allocation of vaccines that has already been provided to the community of Regina. Will hopefully in the days ahead also again be provided to the community of Regina, in addition to the Pfizer and Moderna vaccines that are still being utilized in our mass vaccination clinic. We just don't have the drive-through clinic going now. And as well, you add on to that these public health measures that are in place, I think will prove to yet once again ensure that the Saskatchewan community of Regina, in this case, will not achieve the worst case modeling numbers that were put forward here most recently. The measures that we have in place, I would just state once again, are effective in virtually every other place in the province. As we see, in Regina today, of the 150 cases we had, 91 were in Regina. The next closest area of the province with the highest number of cases was in the northeast at 12. So a marked difference as we see the city of Regina and the rest of the province are on two very different and distinct paths. The public health measures are working for the vast majority of the province, but they are just simply proving not to be as effective as we would hope they would be with the high concentration of variants that we have in Regina. And so that's why we're moving forward with the measures that we have here in place here today. And that will ensure that once again, I'm confident that we will not achieve here in this province the most negative projections that were put forward in the most recent modeling.
We'll take our next question from the room. Adam?
What's being done right now to guard against what we've seen in Regina happening in another community like Saskatoon, Yorkton, Moose Jaw, apart from vaccination. So when we start seeing maybe variants, because I think everyone would agree that they got too high in Regina right now, and that's why these measures are coming at this moment. So what are we doing proactively to maybe put measures in, restrictions in when we start seeing variants rise in these cases, so we don't have to have schools shut down and businesses shut down?
Well, we're doing, there are significant measures in place, not only in Saskatoon, but in every other community in the province. Measures, for example, restricting retail capacity, both 25% at our larger retail stores, 50% in our smaller retail stores. We're still, although there are restaurants that are open in Saskatoon, they're sitting 4 to a table and 3 meters between those tables. We need to identify as well that variants are present. In fact, the first variant that we identified in Saskatchewan was in the community of Saskatoon, but they are present in other communities in the province as well. They will, over time, because they are more contagious, I think it's fair to state that they will become the predominant strain in our communities as time goes by. And this is the race between the variants and the vaccines. So what can we do to buy ourselves time between now and when we can get as many people as possible vaccinated in this province? Follow the public health measures that are in place, and be very diligent about them. Use your we wash your hands. Use your isogel. Make sure you're wearing, as Dr. Shahab had said, a very good fitting mask. And just be very, very diligent in all of the public health measures that we have in place, regardless of where you live. We need to be even more diligent in the community of Regina. Ultimately, we're going to get to everyone in this province as quickly as we can with the vaccine, and that is our path through this pandemic. All of these health measures are nothing more than a stopgap. In this case, to delay as much as possible the increase in the concentration of the variant in other communities, like we are experiencing here in Regina.
Follow up, Adam?
Just hoping that Dr. Shahab could maybe weigh in on that.
Dr. Shahab?
What are you looking for as far as numbers in other communities when it comes to variants? When you start getting, okay, something has to be done in this community. Is there a number level that you're looking at?
Yeah, thanks. So again, we have really excellent protocols in place in terms of the testing program, where testing is widely available. Increasingly, point of care testings can be deployed. All PCR tests get screened for the SNP SNP assay, which screens for any variants of concern. If those are so, that gives us almost a real-time indication of where else are variants of concern popping up, and then over time the whole genome sequencing. So that informs us, what's happening throughout the province. I think, if we didn't have this variants of concern issue and our case numbers throughout the province had been as low as they are now, we could have looked at further reopening of the economy, like in last year in 2020. But unfortunately, on the one hand, Regina is a cautionary tale that we need to be very careful with reopening too fast. We need to give time for the vaccination program to really pick up, and so it's maybe 4 to 6 weeks only before the most vulnerable 50 and older are vaccinated, and it takes 3 weeks of protection with 1 dose, and then over time second doses will be coming. But then ultimately, not forget that everyone 18 and older should think of getting vaccinated over May, June, as vaccine become available to everyone. And then we need to very carefully watch overall case numbers, proportion that are variants of concern, and our data shows that overall 40% of our PCR test positives are variants of concern, but in Regina that's about 75 to 80%. Rest of the Saskatchewan, it's about 10%. So we still need to absolutely delay as much as we can, variants of concern, not just going out from Regina to other parts of the province, but even minimize interprovincial travel. I've said before, stay close to home over school break, stay close to home when you're enjoying the outdoors, wherever you are in Saskatchewan. Minimize non-essential interprovincial travel. Whenever you travel interprovincially, or if you had to come to Regina and go back, monitor yourself closely, get tested. If you have any concerns, utilizing the significant testing capacity we have, being meticulous about all the measures throughout Saskatchewan, whether you're out and about, being very meticulous and not letting our guard down is going to be essential over the next 4 to 6 weeks, and then we'll reassess where things are at. But then another 4 to 6 weeks, and hopefully by that time, everyone in Saskatchewan has had one dose into their arms, and then we can, be at a very different place. Thank you.
This question's for Scott and maybe the Premier as well. There's been reports about long waits for testing today in Regina specifically because of the higher number of cases. The testing clinic opens a bit later in the day. It's closed around 7 o'clock. What are we doing to increase the testing capacity? And also on the phone line, I've been told that it's a long wait for a callback as well because of the higher numbers. So what are we doing to deal with that?
Scott, are you on the line?
I am. Do you want me to take that?
Yeah, sure.
So Adam, thanks for the question. As you know, as part of setting up the drive-through for vaccination on the Regina site, we moved the testing and assessment center into a new facility on site. We've been working through some of those kinks and saw some of those delays, certainly on the first day of operation. We do have staff and capacity to expand the testing site, and we always have, as you know, throughout the last few months, for sure, in the pandemic, both with respect to PCR testing and contact tracing, as well as testing and assessment. We've always had more capacity than has been utilized. With the focus on Regina, we've also level loaded many of the things around contact tracing. So what I mean by that is we brought in contact tracing teams that work provincially. So it's not just falling on the Regina crew to make sure that contact tracing is happening quickly. So we're monitoring it in real time. Based on what we're seeing today, we'll just bring more resources on. We have those resources available so that we will be able to offer more tests and more throughput at the facility. I do also want to remind folks, though, that although, again, and I know our drive-throughs are popular both on the testing and assessment and on the immunization side, but we still do have a standalone appointment-based testing and assessment center in Regina, and it's not at capacity either. So we're going to try to raise more awareness again to remind folks where to get tested, but we are working on it both from a capacity perspective and bringing on more resources in real time.
We'll take our last question from the phone line.
We have Lara Famanov with 650 CKOM.
Hi there. I was just wondering, why keep gyms and churches open? I understand churches in the Regina area can remain at 30-person capacity maximum, but why is that, and why keep gyms open?
Dr. Shahab, you might have a little more to add, but I would just say the measures that we put in, we've discussed over the course of the last number of days and move forward on. The goal is to just really slow things down, slow down the traffic in and out of Regina for sure, and just slow down the point of contact that people have in their daily, in their daily affairs. We're encouraging people to work at home if you're able. Most of the public service has been working at home for some period of time now and will continue to. There is one last sweep going through to see if there are others that potentially could work from home, but the bulk of the public service, for example, and the Crown corporations have been working from home for some period of time now. That is all in an effort just to slow down the public activity and slow down the number of contacts that people ultimately experience each and every day. And so that is what the goal and the target is here. I would just say one more thing with respect to the measures that we're introducing today. They are not to bring the spread in Regina down to zero. They are not there to control the spread on a long-term basis here in Regina. Access to vaccines ultimately is going to do that for us. What these are are in place for what we hope will be a very short period of time, weeks, not months, so that we can change the trajectory of the rate of infections and ultimately the hospitalizations eventually here in our capital city. Dr. Shahab, anything to add on that?
Yeah, I think even the places that remain open, we need to be doubly diligent. So, if you do choose to, I've always said during the pandemic that for those who are, especially those who are more vulnerable, older, underlying risk factors, partaking in worship services virtually remains important. Getting vaccinated as soon as you can. And then if you do decide to go, follow all the protocols very diligently, mask use, hand hygiene, maintaining that 2-meter distance between people who are not in your household. That is going to be critical in Regina. Similarly, in terms of gyms and, the outdoors is a great place to get your cardiovascular exercise, but if for specific strength training, you do need to use the gym. So again, go when it's less crowded, wear your mask as much as you can, hand hygiene, physical distancing inside the gym. At the end of the day, all businesses, even those who have had to pause right now, have been doing their best. Customers have been doing their best. But this, variant that's more transmissible just has required us to, pause some sectors, but not maybe all. We'll need to keep monitoring all sectors that remain open to see if there is still an issue there. But, in the recent past, we've seen sporadic outbreaks, but no super spreader events. And again, the variant of concern can cause those kind of super spread events anywhere in the province. And we need to just be very cautious about everything we do, be aware of the guidelines and be doubly diligent, not just in Regina, but anywhere in terms of staying within those guidelines. And really, at the end of the day, if all of us do those little things diligently, I think that's what's always brought the curve down in Saskatchewan, and that's what we need to do now.
Follow up, Lara?
Yes, please. Are we seeing more younger people? By that I mean those under the age of 50 in ICUs in the Regina area? And if so, is that because of the variant, or is it because of older people who have had their vaccines?
Scott or Doctor, I'd let you likely have something to add to that. I would say the first is a positive of that. And I think I'd stated earlier where we may be by April the 10th, and ultimately a few weeks after that, be in a fairly good situation. But there, our long-term care centers, for example, the residents had over a 90% vaccination rate, very, very positive vaccination rate. Our healthcare workers, 40-some thousand healthcare workers that qualify for phase 1. We'd like to see more of those healthcare workers taking up the opportunity to have access to their vaccine. I believe we're about 57% of our healthcare workers have that qualify for phase 1 have taken the opportunity to actually get their shot. So we would ask, many more of those that do qualify to, make the call and make their appointment. But we aren't seeing, and Scott, you'd have more to add on this, but we are seeing a level of protection in our long-term care facilities, for example. We are seeing a level of protection in those folks that are being vaccinated. That's why we did, in the early days, focus some of our vaccines into the far northern areas of the province to ensure that where we had a per capita fairly high rate of COVID, that we were providing the opportunity for folks in those communities to ultimately be vaccinated. And this is where I think the positive place that we're heading, even as early as sometime in April, where we could, as I say, if we receive this AstraZeneca vaccine plus all of the Moderna and Pfizer that we are scheduled to receive, be in a place where, Regina, for the most part, will have access to 50 and over folks. Will have access to a vaccine, as well as the far north. Yorkton, Moose Jaw, Saskatoon could conceivably be close to having access to all residents 60 and over. And the rest of the province likely will be in that somewhere in the mid-60s where they'll have access or have their appointment booked. So we could be in a fairly strong position in the not too distant future. We just aren't quite there yet. But Scott, anything more on, or Doctor, on the age of, how the vaccines are working in those that have had access to it, and the age of the folks that might be hospitalized or infection? I think 80% of our cases in Regina actually are folks under the age of 50, so it is significantly more prevalent in the younger population than it is in the elderly, which is somewhat of a positive, I think, if we think back not into the not too distant past.
Yeah, I think what the UK showed was that they had their third variant-fueled wave while they were slightly ahead of where Saskatchewan is in the vaccination program. So they showed decreasing hospitalization and mortality in older age groups because of the vaccination program. And while we've always had, more COVID infections in young people because they're more likely to be working in, outside the home, public-facing jobs. The UK data has shown a 30% increase in hospitalization, which again, there's early signals that is a signal that we're picking up in Regina. Our numbers are still low, thankfully, but 13 people in ICU, 27 in hospital in Regina. Coming down rest of the province, a very different trend in Regina, primarily because of the increased case numbers and because they're almost exclusively B117. Thankfully, young people do recover more quickly, but again, COVID should never be ignored, and we should never think that we are invincible. We should follow all these guidelines at all times, and of course, get vaccinated. Even if we are young. But certainly there is 30% more virulence of the B117 strain and 70% more transmissible. So twice as hard to control. But again, it can be controlled. We are hopeful that it will be controlled in Regina, and we need to do our level best to minimize its transmission in the rest of the province while we give the space for the vaccination program to really start showing benefits, not just in the 80 plus, which it is showing now, but in successfully lower age groups as well. Thank you.
Scott?
So just to agree with what Dr. Shahab and Premier have already said, but not only are we seeing that benefit, so going back, and you've heard me say this before, I think on January 17th, we had over 226 individuals in long-term care facilities that were infected, and today it's a handful. So we do believe, like Dr. Shahab has said, through experience in other jurisdictions, that it is taking its true impact on our most vulnerable elderly and protecting them. As we move through the vaccination program quickly, again, as the Premier and Dr. Shahab have outlined, we will have more people protected down the road. That does take some time following the vaccination, but just to reiterate what the Premier said, we will be moving into the 65 plus provincially and opening up the booking system within hours. So we are moving throughout those age limits, and as vaccine supply is more stable and coming, we will ensure that those are being put in the arms of Saskatchewan residents as quickly as possible.
And thanks very much. That concludes our press conference for today.